Hello, my name is Aditonshe Ademoye, and I will be presenting on prevention strategies and herbal remedy treatments for COVID-19 among Nigerians in Baltimore County. COVID-19, the novel COVID-19 health crisis almost brought all activities across the world to a halt. The disease is caused by severe acute respiratory syndrome coronavirus 2. As a result, governments worldwide implemented emergency measures such as the forceful closure of businesses, the imposition of lockdowns, and quarantine facilities to ensure that the affected individuals do not spread the virus to other parties. The virus spreads faster through physical contact and has forced governments to apply effective measures to reduce its spread. The applied measures has made various societies abandon their traditions and embrace a new normal in almost all spheres of existence. That said, COVID-19 will be discussed further in detail in an international view by analyzing COVID-19 management and prevention strategies amongst Nigerians in Baltimore County with a specific interest in herbal medicine for treating the disease. The significance of the study aims to investigate prevention strategies and the effectiveness of herbal medicines for the management of COVID-19. The available data on those infected with the virus show close to 20% of patients under critical conditions will require extended hospitalization. This adds to the debt of countries worldwide because most people and insurance companies are unable to afford to pay for the charge of that magnitude. Statement of the problem. One of the critical contributors to the rising numbers of deaths by COVID-19 patients among Nigerians is the myth that Nigerians are immune to the virus. That's definitely a myth and part of the problem. Baltimore County has reported an average of 185 daily infections and 2.5 deaths daily, an average of 22 per 100,000 people respectively. Now, based on these statistics, Baltimore County citizens are at risk for infection and death than the other counties in Maryland. The above data shows that coronavirus is a big problem in Baltimore and available remedies need to be investigated for possible solution to the problem. One of my research questions is, what prevention strategies do Nigerians in Baltimore County practice to prevent COVID-19? My PICO question is, among Nigerians in Baltimore County, what are herbal remedies' effect compared to Western medicine on the management of COVID-19? Definitions. Some theoretical definitions used in this study includes pandemic, virus, and prevention. Now, pandemic, which is described as a disease condition affecting the country as a whole or the entire world. A virus can be described as an organism that can remain biologically active in different natures. This virus likes cool, dry conditions, which is also related to more respiratory tract infections. According to the CDC, coronavirus is a preventable disease. Prevention here means stopping the spread of the disease. Operational definition for the proposed study: the term herbal medicine will be applied to mean a mixture of green plants and other materials from rural homes. It is also known as the application of homemade medicinal substances. Literature review. There are several evidences to show a widespread of herbal medicines to combat illness. Many tribes around the world believe in the use of indigenous trees and herbs to combat various diseases, including coronavirus. For example, China has been documented to using herbal medicine as a trial for treating COVID-19. The extract of Artemisia annua has for a long time now been used to treat fevers, malaria, and respiratory tract infections. Another technique that has been applied includes turning up the heat in homes to reduce the virus's effects. The concept is that the viruses are destroyed by high temperatures tolerable to humans. My mom is one of the individuals that strongly believe in this application of heat as a treatment and prevention to managing the disease. Several measures recommend that help reduce, several measures several measures recommended have helped reduce the spread of COVID-19, such as frequent hand washing, use of face masks, and maintaining social distances. Doing these effective risk management practices will reduce the spread and effect of COVID-19 across the globe. Methodology, study design. The study for this the study design for this study will be qualitative to ensure a comprehensive description of study variables. The advantage of choosing a qualitative method is to ensure, as I said, a comprehensive description of study variables. Another advantage of using qualitative research design is collecting data that is not restricted to the research questions and limiting the focus area by confining the participants' responses to the questionnaire. The study will use a qualitative single case study. The sample. The method of data collection will involve administering questionnaires to Nigerians living in Baltimore County. It will be a sample of 50 people. If you feel I need to adjust it and make it a little larger, please let me know and I can make an adjustment where needed. Settings. The setting will be at Jesus House, Baltimore. Jesus House, Baltimore is a church in Baltimore County that boasts of a huge number of Nigerians, and it can be considered as the number one source of approaching the citizens living in the county for consent during the research. Limitations. The research anticipates the issue of availability of enough finances if needed, lack of representative population depending on the age range, time and time management constraints as part of its challenges it will face. The data collection techniques involves administering of questionnaires that collect the respondents' demographic information, their perception and experiences, and their approach to the findings of how they prevent COVID-19 and how herbal medicine is used to cushion COVID-19 effects. Protection of human subjects. The questionnaires will protect the confidentiality of the respondents by having codes to allow the respondents answer the questions anonymously to protect and ensure confidentiality. Confidentiality. Okay. Instruments and tools. The primary sources will be going to the field and collecting first-hand data from the participants through surveys, observations, administering questionnaires, conducting focus group discussions, and interviews. Data analysis. The descriptive and numerical data that will be collected will be analyzed using Excel to provide interpretation and display. Summary. The COVID-19 has had a negative effect on the world in total since it was discovered in Wuhan, China in 2019. The effects of COVID-19 have had adverse effects on every aspect of the economy. The complexity of the disease has made treating it or preventing it very difficult. I work in the emergency room, so it's a battle that I see us struggling with on a daily basis. Modern medicine have proved ineffective, and some countries have opted for herbal medicine to reduce its severity. All countries must use prevention strategies in managing the spread of the disease. Herbal medicine, as an alternative to Western treatments, can be essential and effective with the use of medicinal plants that have pharmacological and biological capabilities that can mitigate the effects of COVID-19. Plans for implementation include going to Jesus House, Baltimore, getting permission from the executive pastor, which is Pastor Tola Odutola, offering surveys, collecting data, reviewing, and analyzing the results. I want to say thank you for taking the time to listen to me and enjoy the rest of your day.